Hello everyone. I hope you are doing well in your life. And today we are going to discuss one of the most important hormone of the endocrine system, that is cortisol. And we also know that cortisol is known regarding two another disease conditions, that is Addison disease and Cushing syndrome, which we will discuss later on in the end of this lecture. So let's begin our journey with, first of all, hypothalamus. As we know that hypothalamus is the chairman of the endocrine society, and it is having paraventricular nucleus in it, paraventricular nucleus, which gets stimulated with some factors. I will tell you these factors during the lecture period, but please trust me that we will discuss them later on. Now, as the paraventricular nucleus is stimulated, it is releasing the hormone CRH, or the corticotropin releasing hormone. The corticotropin releasing hormone is released by the paraventricular nucleus, which stimulate the anterior pituitary gland to secrete adrenocorticotropic hormone. Ladies and gentlemen, adrenocorticotropic hormone is very important for our survival. Adrenocorticotropic hormone is secreted by anterior pituitary gland, and via blood it reaches up to the adrenal gland. And in the adrenal gland, we had already discussed about its three layers, that is GFR are its layer: zona glomerulus, zona fasciculata, and zona reticularis. And my dear students, the hormone ACTH act on this red zone, second zone known as zona fasciculata, to release the hormone cortisol. Okay, now we had taken this cell out in order to explain what is going on inside the cells of the adrenal gland or zona fasciculata. As soon as ACTH bind on the receptor, it stimulates the G stimulatory process or G stimulatory proteins. Further, the adenyl cyclase enzyme is activated. We already know about this process. Then cyclic AMP is formed, which will make protein kinase A enzyme, in the cell of the adrenal gland in the zona fasciculata layer. All right. Now, as we know that our cortisol is not a peptide hormone. It is we can say glucocorticoid hormone, which is prepared from the cholesterol, and after the dietary cholesterol intake, it is converted into, we can say, prenanolone. Then prenanolone is converted into 17-hydroxyprogesterone. It is converted into 17-hydroxyprogesterone, and this 17-hydroxyprogesterone is then converted into 11-hydroxycortisol under the influence of very, very, very important enzyme, that is 21-hydroxylase. Why I am saying this is very, very important? Because many medications alter the mechanism of this enzyme, 21-hydroxylase enzyme, which is going to make 11-hydroxycortisol, which is further converted into cortisol. Now, what is the pKa or protein kinase A doing here? The pKa or protein kinase A is going to phosphorylate or influence many enzymatic activities, especially 21 hydroxylase. especially 21 hydroxylase, to enhance the production of cortisol. All right, done. We had prepared cortisol in the cell of the adrenal gland in the zona fasciculata. All right. Now this cortisol hormone will come into blood. Now this cortisol hormone will come into blood, and in the blood it is not we can say carried out by the blood freely in the free form, but it has to bind with some proteins such as albumin protein, and 25% of the cortisol bind with albumin, whereas 75% of the cortisol is bound with transcortin. Please note this or highlight this protein, transcortin. All right, or globulin, transcortin. After that, it is carried to different parts of the body. After that, cortisol is carried to different parts of the body. So let's begin with our muscles. Our muscles are having, we can say, receptors for the cortisol hormone, and as soon as cortisol bind over here, it stimulates the nuclear machinery of the muscle cell or the myocyte, which make new mRNA proteins under the influence of hormone activity. New mRNA proteins are known as proteases. You know what? What are proteases? These are cutter enzymes. Which will cut the proteins present in the muscle cells, and these proteins are then converted into amino acids. Amino acids are being made. Along with muscles are also making lactic acid. Clear? Everybody clear so far? Anybody having any doubt, please ask in the comment section till now. Lactic acid along with we can say amino acids are being made, and these are kept over here by us. Similarly, the cortisol hormone. Meanwhile, on the other hand, cortisol hormone also has receptors for on the adipose cells or adipose tissue. Cortisol bind on the adipose membrane and stimulate the nuclear machinery to make similar cutter enzyme. These kind of Caesar enzymes or cutter enzymes known as proteases, which cut down the triglycerides, TGA, triglycerides into glycerol and free fatty acid and free fatty acids. All right, free fatty acids. Now this glycerol and lactic acid, please listen with your both ears. This glycerol with lactic acid and amino acids come inside the liver, come and reach in the liver, and under the influence of hormone cortisol. You know what? Liver has also receptors for cortisol. Hepatocytes are also having receptors for hormone cortisol. Clear? All right. As soon as the hormone cortisol bind on the hepatocyte membrane, for example, this is a hepatic lobule or we can say hexagonal hepatocyte, it is having receptor for the cortisol. And as soon as the cortisol bind on the receptor of the hepatocyte, it stimulate a formation of, we can say, formation of glucose from the new sources. What are the new sources? New sources are glycerol, and amino acids and lactic acid and some type of, we can say, odd fatty acids or lactic acid. All right. So what is this process known as? When our liver make glucose from the new sources, non-carbohydrate sources. It is known as gluconeo. Neo means new genesis. Gluconeogenesis, ladies and gentlemen, is formed glucose. It is quite obvious that cortisol is released by the adrenal gland when there is hypoglycemia. When there is hypoglycemia, or we can say that hypoglycemia is a very strong stimulator. Hypoglycemia is a very strong stimulator for the production of cortisol. All right. Similarly, cortisol has another role. Cortisol can take glucose molecules and make their polymer chains to make glycogen. Whenever glycogen is made in the body, this process is known as glycogenesis. So why our hormone cortisol is storing glucose for future use in case of hypoglycemia, and for converting amino acids, lactic acid and glycerol into glucose, and then again storing it, So kindly note that cortisol has direct influence to make glycogen. Cortisol has direct influence to make we can say glycogen under the process glycogenesis and gluconeogenesis we had already discussed. All right, anybody having any doubt till now, please feel free to ask in the comment section. Similarly, on the other hand, there is another game going on. What is the game? We know that blood vessels are having three layers: tunica adventitia, tunica media, tunica intima. And in the tunica media, we are having smooth muscles, and smooth muscles have receptors for norepinephrine or adrenergic receptors. These are adrenergic receptors. Similarly, meanwhile, the tunica media is having smooth muscles which are having noradrenergic receptors, which is binding with norepinephrine. You know what? Our hormone cortisol is very clever. He is going to amplify, he is going to boost, he is going to increase the sensitivity, of these receptors, of adrenergic receptors. And what is going to happen? Smooth muscle constriction. It will cause, yes please, it will cause vasoconstriction. Wow. Vasoconstriction, BP will increase along with the increase in total peripheral resistance. My dear students, till now we had seen so much about cortisol, its effect on the muscle cells, adipocytes, liver, hepatocytes, and now our blood vessels. Similarly, there is a weird mechanism, or we can say there is opposite mechanism. You know, under the fight and flight mechanism, or under the stress regarding our daily life activities, mental processes, metabolism and injuries, trauma, surgeries, so many we can say stress events are going in the body, inflammation process are going in the body. So there is present our, we can say, nervous system on the hepatocytes also. Our nervous system or adrenergic receptors are also present in the hepatocytes. Hepatocytes are having adrenergic receptors, and cortisol is going to amplify sensitivity of these receptors also to get the effect. What is the effect? It is glycogenolysis, or we can say glycolysis. It is glycolysis. And this glucagon, this glycogen, this all this material that was stored, glycogen, is broken down to get what is to get glucose. During fight and flight mechanism, during exercise, trauma, surgery, this cortisol hormone can increase, boost noradrenergic activity on the hepatocyte, and in order to get glucose released in the blood. First it stored the glucose in the glycogen, then it break down the glycogen into the glucose. It works in contrast with insulin. It works in contrast with the insulin hormone. All right. Till now, we had seen so much about the hormone cortisol, and we also know that what are the positive or stimulants for the cortisol. First is hypoglycaemia. Second is trauma, surgery, inflammation process. Okay. And what are the inhibitors? Inhibitors will be hyperglycemia. Obvious. Clear? Anybody having any doubt? In the end, these soldiers or immune system is left, and cortisol is going to inhibit or decrease our immune cells functioning. And what are these functionings? For example, basophils do what? Basophils release prostaglandin and histamine, right? Prostaglandins and histamine. Similarly, monocytes and lymphocytes. Monocytes, as we know, release interleukin 1 and cytokines, interleukins and cytokines. These are also released by this guy, lymphocytes. All right. So decrease in these anti-inflammatory substances will decrease inflammation process, decrease inflammation process, and our immune system will be altered. Therefore, microbial activity will increase. Similarly, we can say during stress, cortisol is increased and the immune system is compromised. Therefore, we are having infections. You know, during your examination preparation, lot of students are having problems with their immune system due to stress. More the syllabus, more the stress, less the percentage, more the stress, more the failure in the examination, more the stress. What we will tell our parents, what we will tell our society, etc., etc. So this is going to cause infections or poor immune system. In the last, we will discuss, before we advance to the Addison disease and Cushing syndrome, we will discuss about that is normal range of the cortisol hormone. It is in the, we can say, microgram per deciliter, and its normal value is 5 to 25 microgram per deciliter. In 100 ml, there is 5 to 25 microgram of the cortisol hormone present. And when we talk about the regulation of the cortisol hormone, as the blood level of cortisol increases, it will have negative feedback system to the we can say our hypothalamus, that kindly inhibit this process. And as soon as cortisol hormone level decreases, it will provide positive feedback to our hypothalamus to increase its production. In the last, I will also like to tell you something extra, that during our pregnancy period, in the human pregnancy, especially during the 30th and 32nd week of pregnancy, this cortisol hormone stimulate the lungs to release surfactant, which increase lung maturity. So this is all about the cortisol hormone. Now our lecture will shift towards the Addison disease and Cushing syndrome. So now, as you had already understood about the cortisol hormone, its production and its function, now the Addison disease and Cushing syndrome is just a hot cake for us. Addison disease is also known as or having primary adrenal insufficiency, or decreased adrenal functioning, leading to poor production or less production. It is a rare long-term endocrine disorder in which there is inadequate production of the hormone cortisol along with aldosterone. Yes, along with aldosterone. Aldosterone production is also altered along with cortisol in the Addison disease. So it is also can occur due to the damage of the adrenal gland, cancer of the adrenal gland, or the we can say attack by the immune system, autoimmune dysfunction, especially on the 21 hydroxylase enzyme, therefore leading to poor production of 11 hydroxycortisol and cortisol is reduced. And aldosterone, as we know, is produced by zona fasciculata layer of the adrenal gland. So adrenal crisis may be marked by low BP. Why low BP? That is why I am just joined this lecture with Addison disease and Cushing syndrome, because immediately you had understood about the role of cortisol in vasoconstriction and vasodilation. Low BP due to vasodilation. If there is poor production of cortisol for long period of time, it will affect the smooth muscles of the blood vessels. Vasodilation, nausea and vomiting are our common symptoms. Lower back pain, loss of consciousness. Lower back pain can also be lower pain in the back. We can say lower back pain. Okay, you just correct it, right? Okay, so loss of consciousness, lower back pain. Why loss of consciousness? As we had already studied that cortisol is highly responsible for glucose production, so there can be fainting, there can be poor production of glucose, there can be poor gluconeogenesis, there can be poor glycogenesis, there can be poor glycolysis, there can be poor lipolysis. So many functions are altered, so many mechanisms are altered, which lead to our loss of consciousness, or sometimes unfortunately, my dear students, to death also. Low back pain and adrenal insufficiency is the main condition of this we can say Addison disease. So in the Addison disease, you have to remember that nothing is added, everything is reduced, everything is decreased. And secondary adrenal insufficiency, this is the primary, and secondary insufficiency can occur due to we can say cancer of the adrenal gland, poor blood supply to the adrenal gland, and poor production of the CRH, damage of the anterior pituitary gland. Kindly think about this. If adrenal pituitary gland is not functioning properly, is it going to make ACTH in normal amount? Never ever. And is it going to affect the cortisol production? Yes. This will lead to secondary chances of Addison disease. And when we talk about the treatment, treatment of the Addison disease, it is obvious. Synthetic hydrocortisone drugs are used. You know, the medicine name of the cortisol is hydrocortisone. Medicine name of the cortisol is hydrocortisone, or we can also give fluorocortisone. Fluorocortisone, hydrocortisone are given for the we can say making the blood level of cortisol normal. Hydrocortisone pills are available in the market. Pills are available in the market which the patient can take orally, which can be taken orally per mouth, through mouth. And the intravenous fluid, IV fluid are very important. IV fluid with sugar dextrose or IV fluids. Sugar dextrose are very important to prevent loss of consciousness, fall in BP, and to maintain the blood glucose level. This is used as a treatment. Intravenous fluids, sugar dextrose, hydrocortisone, because severe deficiency of cortisol can lead to death. All right. So till now we had seen the main signs and symptoms which are common in the chronic Addison disease, a rare endocrine disorder, and hyperpigmentation. And hyperpigmentation, we talk about hyperpigmentation comes because the melanocyte stimulating hormone and ACTH are having same precursor molecule. If MSH or ACTH is not formed, MSH will form in large amount, which will lead to hyperpigmentation in the buccal cavity, inside the mucosa of the skin, especially those areas even which are not exposed to the sunlight. Fatigue will be there due to lack of glucose. Muscle weakness. Why the muscle weakness? Because cortisol is not there and the muscles will not be able to make amino acids or proteases, so muscle weakness can be there. Weight loss. Why the weight loss will be there? Because the body will try to make or use of fats stored in the body. Diarrhea and orthostatic hypotension. You know what is orthostatic hypotension? Whenever a person try to change his or her position after lying down on the bed and suddenly rises, it causes fall in the BP, blood pressure. So it is very common in the patient with Addison disease. GI changes, my dear students, GI changes can be there, such as you can see on my right side, abdominal pain, weight gain. And when we talk about behavior changes, it include anxiety. Obvious, patient will have anxiety because so many conditions are there. Restlessness will be there, insomnia will be there, altered sleep pattern will be there, and changes in the females include loss of body hair or libido. Loss of libido or body hair can be there. There is also another term which is used, that is adrenal crisis. Anybody having any knowledge regarding adrenal crisis, kindly tell me in the inbox immediately before I am erasing this mechanism, this writing of me. Okay, I want to check that are you fast or me is fast. Okay, adrenal crisis. Ladies and gentlemen, what is adrenal crisis? So you know what is crisis? When our body has to depend upon external sources other than itself. Adrenal crisis, it is marked by severe dehydration. Lack of aldosterone will increase urine output. Lack of aldosterone also will increase urine output, that will lead to dehydration. Lack of water in the body or fluid, nausea, vomiting are typical symptoms of every medical student that he or she is going to tell in the viva. Low blood glucose level, when the lab reports come, decreased glucose, low BP, orthostatic hypotension, change in the cardiac we can say activity, confusion, psychosis, speech problem, even speech requires energy, slurred speech will be there, confusion will be there, or we can say altered mental status can be there, altered mental status. All right, speech will be there, slurred speech, and hyponatremia will be there, as a lot of fluid is going out. So there will be decreased sodium level known as hyponatremia. And whenever there is hyponatremia, there is hyperkalemia, there is increased potassium level, it is a golden trick to remember. Whenever sodium falls, potassium rises because already aldosterone deficiency is there, hypercalcemia will be there, increased blood calcium level, hypercalcemia will be there. So what you had seen, that so many symptoms appear whenever there is deficiency of cortisol hormone. So how this system is diagnosed? Similarly, low blood glucose level, fall in the BP, physical examination, orthostatic hypotension can be checked, high blood potassium level will be checked in the lab report. And when we talk about the eosinophils, lymphocytes, our immune system cells, which we had previously discussed, these will be increased number of WBC will be there, metabolic acidosis will be there. So many symptoms are associated with Addison disease. So treatment obvious, I had already told you, hydrocortisone tablets, prednisolone tablets, and crisis is treated by these kind of treatment modalities used by the doctor. Thankfully, this kind of situations are tackled by the medical staff very easily, or you can say patients are maintained. Even the crisis can be maintained with the help of hydrocortisone. It is quite okay that patient has to take medicine for a long time, but these kind of conditions can be maintained by the medical sciences and the good doctors and nurses. Okay. So now we are going to talk immediately with this topic, that is Cushing syndrome. So what is Cushing syndrome? It is increased blood cortisol level, ladies and gentlemen, can cause over the time increased cortisol level, which can be due to overproduction of cortisol and increased intake of hydrocortisone. All right. So when the patient is taking increased amount of quantity of hydrocortisone, it is also going to increase cortisol level, which can expose the patient to we can say Cushing syndrome. So what are the main sign and symptoms? There was weight loss, there is weight gain, striae formation, pink color, striae formation can be there. Stretch marks, females, especially in females, on their lower abdomen, there will be fatty tissue deposit there, and there will be striae formation, pink color striae will be there, stretch marks, we can say striae formation. Okay, striae formation, right. And there will be increase in BP, blood pressure, moon-like face, as you can see on my right side. The patient pic is there, image is there, thin and fragile, we can say thin and fragile hairs will be there, all right. And it also comes with another sign and symptoms like buffalo hump will be there, striae marks, and thinning of the bruises easily, injury marks easily, slow healing of the cuts and any injuries, slow healing will be there, So in Cushing syndrome, It is extremely opposite with the Addison disease. So we can say that exogenous, yes, exogenous intake of the hydrocortisone can also cause Cushing syndrome. Oral corticosteroids can cause Cushing syndrome. Overuse of, we can say that Cushing syndrome can also be due to injectable corticosteroids. So there can be many reasons for the Cushing syndrome, which can lead to we can say rapid formation of corticosteroids in the body, especially glucocorticoid like cortisol, which can also lead to low back pain. Inhaled steroid medicines are also there. So people without any prescription, without any, we can say, knowledge, sometimes can use cortisol for over a long period of time, which can cause problem in the excessive formation of cortisol. So pituitary gland tumor, anterior pituitary gland tumor can also boost ACTH. It will boost cortisol. Obvious, it's quite obvious. And the tumor of the adrenal gland can also cause the formation of excessive cortisol. You know that tumor of adrenal gland is known as pheochromocytoma. So these topics I had taught you, Cushing syndrome and Addison disease, along with all these, just to make you memorize, make your concept clear that what are these diseases. Some students just study cortisol on one hand and these diseases on other hand. Sometimes they forget, but I believe that when the two processes are joined together in the mind and made notes by the students, it is never going to be, we can say, forget. The student will always memorize that these are opposite conditions, and without please also remember that without any proper treatment, Cushing syndrome can develop complications. Like, yes please, can develop complications like high BP, type 2 diabetes, bone loss can be there, and loss of muscle mass. High BP, right, muscle mass loss, we can say muscle mass, bone formation decreased, or osteoporosis will increase, vice versa. So we can say that it can be treated by, when we talk about the treatment, medicine treatment can focus on reducing the corticosteroid intake, proper diet intake, mental health monitoring to reduce the stress, and along with surgical, we can say alternative treatment include removal of the damaged pituitary gland, removal of the adrenal gland having tumor, all right, and with the laser or radiation therapy. So this was all about the cortisol hormone along with our Addison disease and Cushing syndrome in a very brief nutshell lecture. I hope this might have proven very useful to you. So once again, thank you for watching this video and supporting us. Please don't forget to press the bell icon and the subscribe button.